Hi everyone, I'm Dr. Lauren Pichard and I'm here with my, I guess I can call you an associate, Karen Solger. She's a licensed acupuncturist and we work together a lot in an office in San Diego. And Karen is being willing to be a guinea pig. I noticed the other day that, so we work together a lot and we also trade a lot together. So I noticed the other day, and she's been telling me this for a few months, like, oh, you don't even know. I'm not good at staying angry. I'm good at being angry for 3 days and then I get over it. And so I saw her grumpy for 3 days and then I saw her come in so ecstatic, like, I mean, almost high on like, I'm not angry anymore. And I was like, she really doesn't stay angry, but there's like, I've never seen that before. So I think that there's something that could be integrated a little bit more. I'm not totally sure. So what we're going to do is we're going to explore this. Karen, I think, thinks that we're going to do ancestral clearing.
Probably.
We might, but we also might not. So she doesn't know what we're doing.
Oh, boy.
So I kind of have a little bit of a plan, a vague plan, but I also know that she's a good sport. So we're gonna take her up on this good sportness. So we're going to go ahead and we're going to start. Okay. And so obviously, you know, Karen's my friend. She agrees that this is okay to go on YouTube. You know, if it makes it on YouTube, she's agreed. If something comes out of this, you know, and it doesn't make it to YouTube, then we've talked afterwards and she disagreed. Right? But, okay. So
we like to have fun. You may notice that.
Right. So tell me again
how that works.
Well, about this part of you.
Okay. So
that doesn't like to be angry, I guess, right? Or
I guess my disposition is normally kind of a happier disposition. And so if I'm really depressed or something really bad is happening, I suffer very heavily for about 2 or 3 days. And then it's like I just can't take it anymore. I can't take feeling like that anymore because I don't like being that way. Okay. And so then I go into my happy mode.
Right.
It's part of it's my fire type. Fire types tend to have, you know, they're either very euphoric or maybe they're a little more down. I know that's part of my constitutional type, but yeah, I just don't enjoy it. I know, you know, and so I get past it.
Which is great, right? Yeah. Because we always have a choice of what we want to focus on and how we want to be. But I think that some of the things that I hope you don't get mad at me for calling you out on camera, but I think a lot of people do this, and so I want everyone to kind of learn about this, right? So Karen volunteering herself, she's aware that how she is, we can all be. Is how we can all be. Shut it off for good though. And so by her volunteering to do this, it's really bringing together the humanity within all of us and acknowledging that we all have different parts of us that can continue to grow and to evolve. So the other piece for why we suspect that there's some unintegrated aspect around this is because she chooses to focus on the positive, but there's some kind of stored anger inside of her. And so how do we know that there's stored anger inside of you? How did you become aware that it's not fully resolved and fully getting expressed?
Oh, great question. I mean, if part of it's my constitutional type, I have a lot of wood element in me, and the emotional component is anger. But I've also had some situations that, you know, I became very angry over for many years.
So like overreacting.
And I thought that I was dealing with it, and apparently I was dealing with it from the physical level, such as yelling or, you know, venting or talking to friends about it. But apparently the internal realm, I wasn't dealing with it. And so that's what I need to do.
Perfect. So this is the part that I've heard you saying a bunch of times, and I want to correct you on it because I think that it's a mistake that a lot of us make. So when it comes, we want to express our anger, yes, to a point, right? So it's good to vent, it's good to get support, it's good to acknowledge what's there, but we don't always know how to fully resolve what's happening. So there's also a rule in psychology that when we're angry, anger breeds anger. Right? So if we stay in the angry zone, which obviously you don't do because you're angry for 3 days, but some of you out there might be able to relate. When we are angry, it trains our brain to stay angry. So when something happens, we can automatically get angry. So it's kind of a little bit of a misconception to express the anger. My goal is for us to resolve the anger. So when you talk about, sometimes I yell, I would consider that in the shame dynamic. So it's not shame, because shame would be depressed or feeling less than, but it's shamelessness. So if we're yelling at somebody, we're hurting them, so then they're experiencing shame. And it's really common because we don't know a better way, right? And that's why, there's trained psychologists out there, which I think this is basic stuff. I wish we could all be learning it in school instead of, algebra, right? Sorry, mathematicians. But, but some of the classes aren't as useful as how do we have healthy relationships? How do we have healthy marriages? How do we have, health within ourselves? I mean, and that's not totally fair, because I know that my school did focus somewhat on self-esteem and different things in health class, but anyway, I'm going on a rant. But when we have sex education, let's talk about how to have healthy relationships too, right? Okay.
Well, I get that. It doesn't feel good to express the anger, or there have been times it hasn't felt good.
Okay.
So if it can just be kind of removed
Sure.
from the inside out, that's probably what needs to happen.
Okay, perfect. So
Yeah.
This is where we're going to do something a little bit different than what
Okay.
we've done before. I'm going to ask you to come sit over here, like around those two orange pillows.
Okay.
Okay. So I want you to get in touch with the angry part of yourself
Okay.
over here. And so this is the part of you that doesn't enjoy being angry. But I want to get to know the part of you that is angry and what that part of you has to say about everything that's going on.
Okay. So what do you want me to start with?
So just start kind of role playing with yourself. So this angry part of yourself
Mm-hmm.
heard everything that this part of you kind of said, and but we haven't really given anger a voice yet, right? Because we know that you try to get away from the anger. So I'm hoping that together, by just kind of exploring and providing space, we're gonna get to know why this has been created within you and just gain some more insight into it. We could just clear it. That could work. But it's been kind of long standing, and it's been a coping skill that evolved that I think you might enjoy getting to know about that part of yourself a little bit more. Does that make sense?
So I can say that the anger is basically, it may start out at someone else, but it always ends up back at me.
Oh.
So I can be angry, for example, at my soon-to-be ex-husband, which I am angry, but then I go inside and I go, yeah, but it's my fault. I married him. I didn't leave the marriage earlier. I didn't do the things that I needed to do. So it very quickly turns into myself. Within a couple hours of it being at someone else, it goes back to me.
And so were you aware of that before? I mean, probably at some level you were, but have you said it out loud like that before?
Let's see. I'm trying to think. Probably not in the height of arguments, because my life at that time was really about survival.
Well, I mean, just aware of it for yourself, that's why you push out of it, because you don't want to start picking on yourself.
Maybe. I don't know.
Okay.
Yeah.
But so it makes sense, right? That it's like, and so that's the shame dynamic, right? That's, shameless is yelling at others, shameful is yelling at yourself, basically, right? So it's like, well, I can't keep pointing your finger there because I'm partly responsible for this too. So if it's not your fault, then it's my fault.
Well,
and that doesn't feel very good
I always
either.
end up taking all responsibility in the end. And that sounds really noble, but that's not a great thing either. It's not ever all
Well, it's not
one
realistic,
person's fault.
right?
But it's where I go.
Mhm.
So
Right. So this is right. I talk about trauma being at the core of everything, and then this is the secondary level of trauma, right? So I work primarily with shame and trauma when I work with people. So first the trauma happens, and then we feel like we're not good enough as a result, and there's the shame on top of it. And if I don't feel good enough, the way that I'm going to get out of it from being my fault is, well, it must be your fault. And like you said, both of those aren't realistic, right? Because everybody has a piece involved in it, right? And because life is about learning.
it's true.
Okay. So is there anything else that this part of you, how does it feel to kind of sit in the angry chair?
it's not the most fun part.
Okay.
I like the other chair better. I mean, at this moment, my anger is really, it doesn't feel big.
Okay.
It's not, it can be, it's not just the anger, but the emotion in general can be kind of overwhelming.
Mhm.
Anger being maybe one of the key components.
Mhm.
So I'm not in that mode at this moment. When I am, it feels awful.
Yeah, and so when I see you get out of it, it's almost like you're high with relief, right?
Yeah,
it's like,
it's
I'm
so
not in
much
that
better.
anymore,
It's,
right?
well, yeah.
Yeah.
And I like to have fun, I like to laugh, and I really resent being in that mode. I really don't like it.
Cool. Okay, so switch and come back here.
Okay.
Your favorite chair, right? Laughing about it already. Okay.
So much better.
And so this is a little bit of kind of spatial clairvoyance too. You can
Yes.
feel the difference
I
in
can
each
totally
chair, right?
feel the
Isn't it
difference,
pretty
yeah.
far out?
This is the happy spot.
Right. She's giggling already. She's serious and stern.
And this is what
and
I
kind of
do,
depressed.
right?
This is
It's
yeah.
what
You
I
guys,
do. I just can't stop smiling when
Right.
I'm out of the
right?
zone.
You guys get to
Yeah.
see it. She doesn't have quite the glare she had in her eye the other day, but it's close. Okay.
Yeah.
So what does this part of you want to say to that part of you?
You know, don't sweat the small stuff. That this is just such a better place to be.
Mm-hmm.
And I don't want to spend my life being that other person. And I know that life isn't perfect, things go wrong. These happen to be some fairly big things, but I like to be in this mode most of the time.
Sure.
And so I guess it depends on the situation, but reacting in a smaller way would be a helpful thing.
Okay, good. So switch again.
Okay.
She's trying to be happy about it, but she's not.
Hilarious.
Like I said, she had no idea we were doing this today. So what does this part of you want to say back to this part? Because this part basically said don't sweat the small stuff.
I guess this part wants to say that it feels like it's not in control of that. That these emotions just come up and they're so overwhelming that I almost feel like I'm not in charge of them for that time.
So you feel kind of overpowered by the emotions. Overwhelmed.
Completely overwhelmed. Yeah.
And is it scary to be there?
It's definitely there's fear there.
Alright, so come back. What do you want to say back to yourself?
Well, the rational part of me is doing and saying what I would do, which is when I'm really upset, I try to come up with a plan of action to remedy whatever's going on. And I know that's
So this is so perfect.
That's the physical, right?
That's the masculine.
Yeah. Yeah.
Right, so Karen's, if I can, she's also been working on balancing the masculine and feminine. All of us are probably working on that to some degree, really, because it's good to be in balance. And so,
well, I had to be the man of the family for a very long time, right?
Mm-hmm.
The breadwinner, the mother, the father, etc.
Right.
So
it's different. So this
Yes.
personality is starting to, or this side of you is starting to kind of get a little bit more colorful and kind of, it's like, well, I'm responsible. I have to do
Yes.
these things. I can't sit and sulk too much there, which is interesting because if we want to, I don't want to put too much of your family's stuff out there, really. But so your ex-husband, your soon-to-be ex-husband, was really the mirror of this side. This was the side of you that you didn't deal with, and so physically it manifested as your husband, the part of you that actually didn't want to be in charge and that sort of thing. What's it like to kind of see that?
Wait, I don't quite understand it.
So, because
Say
he,
it again.
okay, so he, right, has a history of not working. He has a history of kind of being too sad to kind of go out and get work.
It's abusive.
So, and abusive. So this is the part of you, right, that abuses yourself or yells at him, gets overwhelmed with emotions, but you've disowned this part of you, right? It's like, well, and not fully because it's allowed to be there for 3 days, but you really push it away. But you couldn't get away from yourself because your vibration, because this is unresolved, was still attracting your husband. He just happened to be the shadow part of yourself that you were disowning. Does that make sense?
That makes sense.
So
Yeah.
everybody,
It's starting to sink in.
okay, so everybody, this is why therapy is a good thing, because when we heal this and resolve this, we get you to be attracted to somebody healthier,
It's great.
right? Yeah, right? That's like the jackpot. Let's have
Yes,
true love.
Yes, exactly.
Okay, in time for Valentine's Day. This is perfect.
God.
Okay. So, what does this part of you want to say to this part of you that feels overwhelmed?
So that one's overwhelmed.
Overwhelmed.
Because I'm already
sad.
losing track of which one is which.
Okay. Well, that might be good because you might be
Yeah.
integrating. We're also kind of doing this in maybe a
Okay.
smaller space.
Okay. I guess, I don't know, take a look at why you need this lesson, or, you know, what you're creating here that is making a mirror to have that lesson.
Okay, so this is awesome. And so you are starting to be more integrated. And she's starting to be more integrated because now you're on board. You're like, you know what? Let's take a look at why this is in our life. So you're already having more compassion for this side instead of trying to push it away.
It's a way to look at it that I've never thought of.
So that's cool,
Yeah,
right?
it's very cool.
How does it
It's-
feel
well,
to
you're
kind of have
very-
that awareness?
Lauren is very intuitive. She really picks up on stuff. It's pretty amazing.
Thank you.
What did you just ask me?
I don't know. I asked you, how does it feel to be aware of, to have this new insight about
It
yourself?
feels better. I mean, in my life, when I have insight or information, that's when I've made my most positive changes.
Mhm.
Once I've understood kind of what's going on, then I've been able to move on and make better choices and so
Totally.
forth.
So now this part of you feels more curious about this side, right?
Yeah. Yeah.
Okay, so let's switch again.
Okay.
And do you feel like you're in trouble whenever you go to this chair or something? Okay. Someone send me back. Okay, so what does it feel like in this chair? I want to really kind of get into this chair again.
Okay. There's some discomfort in my abdomen.
Okay.
Um,
Did you have the
And my-
discomfort in this chair? No. Isn't
And-
that amazing?
and
Just
it is
switching
amazing.
chairs,
And
there's
even
discomfort.
It's in my chest too. It's not a huge amount. It's a small amount.
Okay, well, because
So-
you're not feeling overwhelmed right now.
I'm not at well in
Right.
this moment, right?
Right.
I guess I feel in discovery. Like I'm gonna see what happens, what I feel like when this kind of bubbles up again,
Mhm.
and maybe deal with it in a different way.
Cool. So how does it feel to give space for this part of you?
It's great. It's really good.
Right, and it's in a safe way, right? Because I'm here. I'm not going to let you be
Exactly.
overwhelmed. I can intervene if
But
you
I
get
do
overwhelmed.
want that person to win.
So, okay, well, that's you know
I
what?
want that person here most of the time.
Don't both sides of this want this part of you to win?
Oh yeah, I would
So
think so.
you guys are actually cooperating now,
Yeah.
right? You weren't cooperating before. You were being shoved out and pushed out, and this part of but so we don't want to disown you. We want to bring you back, and yes, we want to heal you and literally integrate you back into this part of you. And it's already starting to happen with just looking at it and providing the space that we did,
I think
right?
it's
Because you
awesome.
guys are agreeing already.
It's awesome.
Okay. So when was the first time you felt overwhelmed that you can think of? Just
Oh, I'm sure it was when I was a child. So I'm thinking of one of the memories of some impatience on the part of my mother when I was very little.
okay.
Without going into detail, I was probably 4.
Okay.
And so I remember being overwhelmed. And I was probably overwhelmed most of my childhood. Wasn't,
Okay, perfect.
Yeah.
And overwhelmed most of your marriage.
definitely. Way more so.
Or
Way-
or at least when the honeymoon period
Right.
wore over, right? I mean, you're
Right.
in love with him at one point, but
Yeah.
because we were unconsciously attracted to everything that's unresolved inside of us, right?
Right.
So the more everybody resolves themselves, the more we get to marry this part of us instead of this part of us, right?
Right.
Okay. So when you were overwhelmed as a child, what was it that you needed that you weren't getting?
I guess love and understanding.
Mhm. which is also what you were kind of literally screaming for in the marriage, right?
Right.
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 Okay. So if we were to reparent you,
Mm-hmm.
and if you could just pick one of those memories from your childhood, is it bringing sadness up for you?
Yeah, there's a lot of sadness there.
Okay.
Yeah.
So nobody else knows this, but we've done a lot of trades back and forth together, and I've never seen you get teary-eyed. So I actually think that this is a breakthrough for you, because you've literally been pushing that away for so long that to actually sit with it, crying is a release.
Well, it's interesting because I did think I was dealing with it. I've done counseling for years. I've done all kinds of work. I haven't just, in my mind, pushed it away.
Mm-hmm.
But I thought I was dealing with it, and apparently there was a part of it that really wasn't getting dealt with, and that's the internal part, the feminine.
Right.
Yeah, yin.
Right, that
We
we're
call it yin.
right. That we're
So,
right.
yeah.
So okay, so let's just stay in touch with the feeling. I don't want to get too educational because I want you to really sit with this. And actually, we can just breathe into it and honor the pain that's there. And I talk all the time, breathing into the sensation, honoring it, helps integrate it, right? It's honoring the part of you that was wounded as a child that certainly didn't need to be, right?
Yeah.
So you said that you had sensation in your stomach and sensation in your chest.
Mm-hmm.
How is that feeling now by just focusing your breath
The
on it?
chest is way better. The abdomen's moved up a little, but it's better. It's better than it was.
So just sitting with it helps. So that's important too, right? We spend a lot of time running away from our feelings instead of just sitting with them and meshing with them. So already you're starting to integrate the traumas that have happened to you. So trying to decide which tool I want to use for this. We could do it internally, but I think I want to keep doing the empty chair piece.
Mm-hmm.
So if we were to put the 4-year-old version of you in that chair, but leave it there and ask you to come back here for a minute.
I assume you want me to do this?
Yeah. Yep.
Okay.
Yep. Right, because this is the part of you that's hurt and wounded from 4.
Right.
So now you get to reparent yourself. So you're going to be your ideal mother here.
Okay.
Right? So what did the little girl that didn't feel loved and supported and felt overwhelmed at the inpatients, what did she need to hear?
She needed to hear, I love you, and I understand you, and everything's going to be fine. You're taken care of.
Okay, so switch again. How does it feel to get that? You haven't gotten that in a really long time.
It feels really good. Definitely.
Does it? Or are you just saying that to make me happy
it
for the
does.
video?
No, it
Okay.
does. My stomach feels better. There's just a little flutter in there.
Okay.
And I definitely feel different. We'll put it that way.
Okay, cool.
Yeah.
Anything that you want to say back as a 4-year-old?
I don't think I was with it enough to know what to say back.
Well,
back then.
I
I guess
okay.
I would just say.
Do you have any questions about anything? Is there, I love you and I understand you, but is there more? The flutter kind of suggests that there's more.
Yeah, I mean, it's a tough call because that child is going to have to go through a lot of no understanding and very little love for many years. So it's a hard question to answer. I can't go back in and change this person's life in terms of, I can't change the experiences that happened. They happened.
We sort of can.
Okay, well, that's probably what
we can't,
need,
but we
because
sort of can, and we're going to. Right.
As the child, it feels very hopeless because it's so many years of abuse from the parents.
Sure. So
and
how
then later with the
doesn't
spouse.
that explain all of the overwhelm?
It does. It does.
Right.
Yeah. But it feels hopeless to me for the child.
Sure.
Because I know what the person, it's me. It's so weird talking about me, but I know what I'm going to be going through.
Right.
And I'm not sure that there was a way to handle it any better as the child, because you're innocent. You don't have the ability to change your situation when you're a minor. You know? So
switch.
I feel sorry for her.
Me too. Right? Deep empathy,
Yeah.
right?
Yeah.
So what does this part of you want to say to that part of you that feels hopeless and overwhelmed?
I guess, hang in there, and there will be some light at the end of the tunnel. And
So, okay, I'm going to stop you because you're sounding a little, this is what I should be saying.
no, it's just that I don't know how to say to myself anything positive about that experience.
Okay, good. So come back. I'm going to help you.
Don't
That's
know,
good.
don't know
Well,
how to do it.
that's
I
why
really
I'm
don't.
here, because we can't
Yeah.
see it ourselves,
Yeah.
right? So I'm going to be this version of you,
Okay.
and I'm going to get my New Jersey potty mouth out, because that's kind of where I go to first, and talk to a 4-year-old, right? So, you know what? It is really hard what you're going through. It's not fair. Our moms and dads overreact sometimes. We don't always get our needs met, and I see that you don't know how to get the love that you want. And I'm sorry for you because it's actually going to be hard for a long time, right? And it's going to be overwhelming, and it's going to be sad, and it's going to be hard. And I wish I could help you, but there isn't much that we can do about it.
I'm not going to cry on videotape, but it brings me to want to do that.
Well, you should let yourself cry on
My
videotape.
makeup's going to run and the whole thing, but it
Well,
makes
but
me
it's
sad.
worth the healing, you know what I'm saying? But yeah,
It makes me
So-
very sad.
yeah.
And I have to say, the tears I've cried in my life, there have been many, and I never felt like it really helped me all that much.
So
Didn't
that's
really,
that's part of what. So the tears, we want when they come up, we want to feel them, just like we want to feel the sensations in our body, but we don't want to have a story about them, right? Because when we create the story, we create the karma, or in psychology, we call it the cognitive loop of staying in that, right? So if we're crying and we're feeling sorry for ourselves, well, then we're crying and feeling sorry for ourselves. But if we're just crying because this part of you's been here for a long time and hasn't gotten a chance to be healed, and here we are healing it, and it brings up sadness, you're not judging that sadness, you're just sitting with it with me right now. So you're freeing yourself from the cognitive loop or the unconscious process or the karma of it, right?
Yeah.
Does that make sense?
well, I guess I just feel like I cried so many tears, and it didn't really do much for me. And so I felt like it's pretty useless. It's not that I don't cry, I cry often, but I haven't felt like it's been helpful.
And that's probably another reason why you push this part of you away.
Yeah.
Right? Because you've been kind of like, well, what good are you? Right? The crying it doesn't bring me anything but pain.
Right.
Except when we cry correctly, it can bring us relief.
Yeah.
Right?
Well, and it doesn't also necessarily put you in a different situation. So if you're crying because you're unhappy something happened, it doesn't change the something.
Right. So this is the part of you that gets to change the something.
Right.
Except when we raise your bottom, it does change your unconscious, so it changes what you attract in the world, right? Because we attract what we are.
Yeah.
So, do you have any more questions for this part of you that I am now being?
I guess it would be more just to give the advice of somehow trying to do these integrations so that we can move on and be that person. Because that's really who I feel that I am. It's my nature.
Mhm.
This
It
is
is.
not,
This
this is
literally
not
is
my
your pain
nature.
body, and
this
this
is
literally
my
is your
pain and the
wounding.
crummy stuff.
But if we
and-
keep pushing it away, then
Yeah.
we don't
Right.
really get to be this person,
Right.
right? And so, and we can't. I mean, I like to kind of rush through it too, right? That fire in
Yeah.
us, I think.
Yeah.
But
Yeah.
we can't really rush through it because that actually gets overwhelming too, and we can change so fast that we don't get a chance to really know who we are, and we can get ungrounded. But,
Right.
but I mean, this is like a really big piece
Mm-hmm.
that you've done,
Yeah.
for sure. So there's part of you that's like, I don't want to be in this chair anymore. Is that kind of what you're saying?
Definitely.
Right? How do we get through it
Right.
faster?
Right. And I understand life has problems and issues, but these are some pretty big ones. It's not, I was late for an appointment, now my life is over, it's
Mhm.
this bigger stuff.
Mhm.
So, yeah, I would love to get past it.
And you are, right?
to not manifest this anymore in my life.
Sure.
In a negative way.
So, so I want to just continue with the dialogue between you. So why don't you come here and see what you want to say to yourself? We do musical chairs in my therapy sessions.
Exactly.
Yeah.
It's always fun with Lauren.
She's in the fun chair again. It's fun. Before she couldn't wait for it to end. Now it's fun again.
True.
Now therapy's fun again.
It's true. What do I want to say? I mean, I guess I want to say that you're going to go through a lot and it's going to get better. There's also going to be some really bad stuff coming up, you know. But the good stuff, this side of it, is so good that it's worthwhile with what you have to go through to be here. For whatever time you get to be in this chair.
Totally.
It's the great place to be.
So as she thinks session is coming to an end, which it actually might be because she's treating a patient right now, you're separating yourself again. Do you see that?
Yeah.
You're like, you gotta go away, which is actually okay, right?
Yeah.
I mean, if I'm having a bad day at home, at work or something, I can't bring that bad day with me.
Right.
So it's okay as a coping skill, but we want to just make sure that we don't leave this part of you kind of suffering anymore, right? Because when it comes up, if we heal what's there and all the times that it's happened, it's going to be less overwhelming each time you feel unloved.
So then my question would
unsupported.
be, what work can I do on my own in between sessions to make this transition, or what are you calling it?
I'm calling it an integration.
Integration, to make this integration more successful. What do I do when the bad stuff comes up? Do I talk to the happy self?
I do have a patient that's like, I started talking to myself last week. I was like, did you? That's awesome. I've thought about doing it, but I can't
doing it.
Well, it works. Well, I think that your thoughts are already changing about it. So it doesn't have to be out here, right? We've already given and provided, I kind of modeled a healthier way for you to kind of support this part of you instead of pushing it away.
Yeah.
You're already aware that when those thoughts and stuff happening, that it's the shame dynamic, right?
Mm-hmm.
So being aware of it, you can now be like, all right, I don't want to even have these thoughts, right? So how do you not have those thoughts? What do you do?
Well, you work them out somehow. You go through them, or you feel them.
So when we practice the
Mm-hmm.
ancestral clearing,
Mm-hmm.
we're practicing mindfulness too, right? So to not have them, we bring our attention to our sensations in our body and on our breath, and we focus on it. And that is automatically giving ourselves space so that we can integrate those parts of us.
And is that it?
It's that
Because
simple.
that's what my Reiki person has also told me.
It's that simple.
Just to go inside the body, find where it's sore or uncomfortable, and then just breathe. And I have been trying to do that more lately.
Because that's you actually honoring this part of you. It's providing space for the discomfort.
Yeah.
And why it's the mind gets you out of the dynamic so you're not building up the karma anymore. And then I can give you some prayers too in case you really are feeling overwhelmed for you to read to help shift that energy faster and resolve some of the hurts. So that there's, because it's when we're super, super overwhelmed, it's hard to focus on our breath, right?
Yeah. That's what happens, is it's totally overwhelming, and there's not enough focus to do any sort of practice. It's just all over the board.
And so another option for you could be left hand, right hand writing, right? So kind of the same concept as this. So, your right hand might be this part of you that's usually in charge, and your left hand's kind of this part. And so what do you have to say to yourself about this?
Okay.
Right.
Yeah.
So
Makes sense.
Yeah. Thank you.
So there's hope.
Thank you for being there's always hope.
There's hope.
There's always hope. So thank you for being a good guinea pig and being willing to switch chairs when you didn't know that's what you were up to. If you want to go back here, I can do a clearing on you to kind of get any loose ends around it. And this might resolve a lot of it, really, right? So when you think about all the hurt that you went through as a child, all of the hurt that you went through
Closing my eyes.
in your marriage, it's totally up to you. The camera can't see your eyes anyway.
Okay,
that
that's
angle, I don't think. So how does it, what are you feeling in your body right now?
I feel something kind of on the right side of the abdomen.
Okay, so notice that sensation, and I'm gonna clear you out loud today because I haven't done that yet. So slow, deep, deep breaths. So consciousness for Karen, for all of her family members, all the relationships, all our ancestors, all the relationships through all space, time, dimension. For all times they didn't feel nurtured, loved, and supported, and times they didn't nurture, love, and support others. For all times they were stuck in a shame dynamic and they didn't know how to get out of it. For all times they pushed away their hurts and their sorrow, not knowing how to fully resolve it. Please help them all forgive and release each other, forgive and release themselves, please and thank you. For all times they blamed themselves or blamed others. For all times they felt misunderstood by their mothers or misunderstood by their fathers. Please help them all forgive and release each other, forgive and release themselves, please and thank you. For all anger and resentment towards others and towards themselves. For all mental illness and things people use to avoid, such as shopping or using or eating. Please help everyone involved forgive and release each other, forgive and release themselves, please and thank you. For the highest good, please lift it all weight, pain, burden, sin, death, debt, negativity, and replace it with your light and love, and let your light and love flow into Karen, filling her completely, please and thank you. How does that feel in the right
That's
side?
way better.
Great, so we'll end there. We can certainly pick up again. Thank you for being willing to be
You're welcome.
vulnerable and you know, it's real, and that's really what makes it a healing opportunity for other people, because I can't tell you how many people are going to be able to relate to what you're going through right now. So
I hope nobody else has to go through this.
life's
With
hard for a
themselves,
lot
I
of
mean.
people.
Yeah.
But,